Welcome, everyone, to the Journal, a Marital and Family Therapy's Decade in Review series, hosted by the American Association for Marriage and Family Therapy. The special Decade in Review issue is the fourth of its kind over the years and assesses the efficacy and effectiveness of couple and family therapy by reviewing rigorous studies published over the 10-year period from 2010 to 2019. The findings from the issue show tremendous progress and achievements made to date, inspiring continued commitment to making marriage and family therapy and interventions widely available. Throughout the series, we'll talk directly with the authors who made this special issue a reality. Today's focus is on substance use disorders, and I'm joined today by Molly Bobeck and Dr. Jeremy Schumm. First of all, thank you both so much for being with us here today. My first question, thank you so much, is for Molly. To help us sort of set the stage a little bit, can you tell us about the need for couple and family-based interventions for adults and adolescents with substance disorders? And why is this an important topic? And what substance disorders did you focus on for the article?
Thanks, Glenn. It's really nice to be here in conversation with you and Jeremy, and I appreciate the opportunity to set the stage. I think it's important for us to focus on couple and family therapy for substance use disorders for a couple different reasons. I think number one, substance use disorders are incredibly prevalent. We also understand that substance use disorders and substance use problems have a really profound impact on family life, and also that family life can have a really significant impact on substance use problems. There's that recursive relationship there. And so as we're thinking about family intervention science and thinking more about effective approaches for couple and family therapists, substance use disorders are incredibly important. I also think that it's important to note that we want to focus on family and couple therapy approaches because, as we'll continue to talk with you today, there's a tremendous evidence base for relational systemic interventions for substance use disorders and substance use problems, yet there is a big gap in its practice. So how can we focus on what works? How can we promote what works? How can we be in these kinds of conversations where we're talking about these practices and how effective they are so that we can narrow that gap of research demonstrating couple and family therapy interventions effectiveness and what's actually happening in routine care. In terms of which substance use disorders we focused on, we understand the diagnostic category to be really broad. We understand substance use disorders to include alcohol, to include licit and illicit substances, to include prescription medications, not as prescribed. And so we're focusing on folks engaging with substance use that is problematic, that is interfering in their life in significant ways. And that's how we arrive at the diagnosis.
Great, thank you very much. Jeremy, over to you. Can you tell us a little bit about the impacts on the relationship between those who suffer from substance use disorders and their families?
So picking up what Molly said, the research really shows that there's a bidirectional relationship between substance use disorders and relationship functioning within the families. So that is, substance use disorders negatively impact the relationships that people have with their family members, and family relationships can impact recovery from substance use disorders. For example, substance use disorders can lead to arguments and cause communication problems, and in some cases, even contribute to violence within family relationships. At the same time, the relationship can impact recovery from the substance use disorder. For example, individuals with substance use disorders who are in family environments that are characterized by hostility and contempt are shown to relapse quicker.
Thanks very much. Molly, bringing the focus specifically to adolescents with substance use disorders, how are they impacted and why is family therapy important?
I think it's a really important question, Glenn, and it's really important for us to think about young people, especially as we understand what it means to be an adult with a substance use disorder and how often those adults' difficulties began as youth. Just like Jeremy was saying, We understand family relationships to be such an opportunity, to be so vital for recovery, for healing. And when we're talking specifically about young people, this is abundantly clear, and the evidence is especially clear that ecological family therapy, that systemic family therapy is incredibly effective for young people. We understand young people to be profoundly impacted by substance use problems. Just like there's this bidirectional influence between family relationships and substance use problems, for youth, there's a bidirectional influence between trauma and substance use problems. Youth that experience trauma are at a higher likelihood of experiencing a substance use problem, and youth with substance use problems often experience traumatic events because of their substance use problems. And so that profound impact requires us to really think carefully about what the most effective approaches are going to be. And when we're looking at those effective approaches, family therapy really rises to the top with a lot of clear evidence. And in the way that Jeremy was saying, family therapy creates the opportunity for the relationships to be the mechanism for change, for positive change. Adolescents and young people can be the family of origin, can be a family of choice for adolescents, but how can these relationships be the mechanism, be the asset that young people can rely on so that things can be transformed for the better?
Thank you very much. So Jeremy, what did the article tell us about the effectiveness of couple and family-based therapies to treat substance use disorders? And were any particularly promising treatments identified?
So we looked at studies of couple and family therapies for substance use disorders that had been completed over the past decade. And we selected studies that were randomized clinical trials because these are the scientific gold standard for determining whether a treatment works. We found 13 studies that met our selection criteria. And based on the results of these studies, we found that multiple types of couple and family therapies had strong empirical support as a treatment for substance use disorders. Some of these treatments were shown to work well as a standalone treatment, meaning the protocol is delivered by itself and not with another type of therapy. For adolescents, we found that various types of systemic family therapies were well established, meaning they had good evidence. One study also found that a form of systemic family therapy worked for adults. For adults and adolescents, there was evidence for the efficacy of behavioral family therapy and behavioral couple therapy, although more studies are needed to replicate those findings. In addition to investigating couple and family interventions as standalone treatments, some of the studies looked at these treatments as part of a larger package, meaning they were delivered alongside other treatments. And they combined couple and family treatments with other treatments. And those studies found that behavioral family therapy and behavioral couple therapy showed good evidence when they're included as part of a larger treatment package.
Thank you so much, Jeremy. So Molly, were there any areas that were identified where maybe there was more research that was needed?
Thanks, Glenn. I think there are a few different areas where we could point our resources to understand more about relational interventions and substance use problems. I think the first area of potential research relates to that gap I was talking about at the beginning of our conversation. When we're looking at the surveys about what treatments are provided, SAMHSA's national survey didn't reflect any of those specific interventions that Jeremy was just naming. When providers were asked, what evidence-based treatments are the clients in your care receiving, family or couple therapy is just in a catch-all category versus all of these different discrete protocols that we know, as Jeremy's saying, can have a major impact, even though they're different. And so understanding how we can transform the national system of substance use care to be family focused, to be family committed, to be inclusive of families, not blaming of families, but welcoming, embracing of families. How do we do that? How do we transform the system of care in this way is a really important avenue for us to explore. And something I know that Jeremy and I are committed to together and in different ways. I think the second place of potential further research is how do we understand these different approaches, the couple therapy approach, the family therapy approach, and what would it mean to think transdevelopmentally? one of the things that we sometimes talk about is everybody is family to someone. And we have some of these silos or these boxes that this is for a couple and this is SUD relational treatment for a family. And what if we tried to dismantle some of those silos a little bit and talked about relational interventions that need not be housed in family therapy for adolescents or couple therapy for adults? And how can we expand our approach? And then lastly, which is sort of related to that, the second place of opportunity, how can we continue to think about making some of these manualized treatments that have been effective more accessible, more sustainable, so that again, that gap can be narrowed. So thinking about what are the core elements, what are core elements of these approaches that again can be distilled. So we want to make it as possible as we can for providers to be utilizing this treatment. And so that's where I'd put all of our shared collective resources if I could. How do we narrow this gap? How do we make this approach, which we know to be effective, available to folks that need it?
Great. So you'll both get a chance to answer this next question, but let's start with Jeremy. In just 30 seconds, what do the results of this research review mean for therapists?
Therapists should be aware that including family and couple therapy into addiction treatment is likely to improve outcomes for both adults and adolescents. It's been a myth in substance use disorder treatment that individuals need to focus exclusively on themselves for a period of time and not address family or partner relationship concerns until they're further along in their sobriety. The existing research tells us the opposite, that including family members and partners into treatment actually improves outcomes.
Interesting. Molly, over to you with the same question. What do the results of this research review mean for therapists?
I think Jeremy is absolutely right. I think when we're understanding substance use problems as an individual problem, something that exists within somebody rather than between people and between people in larger systems, we're missing some really important facets of this problem. In addition to, Jeremy, what you're naming around how involving family members can improve outcomes, I guess I just want to underline relationships are healing. That's why a lot of therapists went into the line of work, because we wanted to be in healing relationships with people that were struggling. And how do we expand that frame to be welcoming of family members, to think really broadly about what family relationships are and can be, and invest in that. From the moment someone gives us a call to the time we're sitting in a treatment room, how do we think about improving relationships as a really fundamental, salient goal?
Thanks so much. I want to say thank you to both of our guests today for taking part in the Decade in Review series and for your insightful commentary on the current state of research around couples and family interventions for substance use disorders. Your work will be invaluable to advancing the profession of marriage and family therapy. And finally, I want to say thank you to all of our viewers for tuning in today. We do hope you'll reach out with comments and questions. Do feel free to join the conversation on Twitter by tagging @the AAMFT, that's @the AAMFT. And you can visit the link on screen to read this article and more from our Decade in Review series. Thanks so much. Have a great rest of your day.